Dr. Lynn Karr. I'm a pediatric dentist here at Pediatric Dental Care, and I like to let parents know what to expect with their child for their first dental visit when they come to see us. Here at Pediatric Dental Care, we follow the American Academy of Pediatric Dentistry guidelines, and that basically states that all children should be seen by a dentist by the age of 1, which is establishing a dental home. Their recommendations also include brushing regularly morning and night, and keeping the areas of the teeth clean. Also at the first visit, we like to establish risk level, so talking to the parent about bottle use, pacifier use, thumb sucking or digit habits, also brushing techniques and how frequent they brush at home with their children. This establishment of a risk level lets us know how often the child should be seen following that first visit and if they need a dental cleaning so soon early on. The next thing we like to talk about is instructions on diet, and that includes healthy snacking. So cheeses, fruits, and veggies are great healthy snacks that don't stick to the teeth. And we try to explain to parents to avoid snacks such as crackers and chips and things of that nature, as well as Powerades and sport drinks and juices. Prevention here is a primary focus of our office. We talk a lot about educating the children on what to choose at home for healthy snacks, as well as helping to educate the parent on good habits at home for their children and helping them assist with brushing up through age 7. X-rays are something we talk about also on the first visit, and only when necessary. We don't take them all the time, but only when necessary. And one of the things that we talk about with X-rays is that they show us cavities or any kind of lesions that are starting between the teeth where we can't see. This is an example of a model I show a lot of my little patients, and it basically has little teeth in front, and I tell the kids you can't see between them unless we take this picture because I can't pull the teeth apart. And so once they see that, most kids are going home flossing every single night because they see the sugar bugs that we show on the little models. It's very important because that's where I can't see, so I can't tell parents for sure if they have cavities in between there, although they're not necessary sometimes that early of an age. So that sums it up. On the first visit, we like to count the teeth, talk about diet instructions, oral hygiene instructions, development, anticipatory guidance, which includes the bottle use and pacifier use and all those things I just mentioned. And we try to make it a fun visit for the kids when they first come. So bring your kids on in. We'd love to meet them, and we would love to be their first dentist.
She helps us, and she does really good on helping us feel better. And I like her. And it didn't even hurt, and I thought I was done already. She helped me, and then she was super nice, and I liked her. I wasn't afraid, and it just felt good to me.
Growing up, my parents took me to the dentist every 6 months. They drilled in us how important it was to have good, clean teeth. And I even remember from a child being terrified of my dentist. I remember how dark it was, how cold it was, not liking my doctor or my dentist at all. And I think that instilled in me something that through the years as I got older and got my orthodontic work done, that I was always afraid of the dentist. I will still drive by my dentist and be afraid. And I didn't want that for my children. I knew my children were going to have problems with their teeth and they were going to have issues that needed to be taken care of, and I did not want them to be afraid of their dentist. I didn't want it to be a fight. And so it was so important for me to find a good pediatric dentist to where it was a fun experience, if that was even possible. And with Dr. Karr, we have found that 100%. I'll pick them up early from school, or we leave in the middle of a summer day and I say we gotta go to the dentist, and there's not a fight, it's not a struggle, it's everybody gets in the car and we're okay. The staff, from the moment I walked in the door that very first time, the staff was 100% helpful, which is so important to me, because even if the staff isn't helpful and workable, then it turns me off to whatever office I'm in. And from the staff to the people who cleaned the kids' teeth to Dr. Karr herself, everything was 100% what I expected and what I needed for my children. My daughter Madeline has had lots of work done, has had teeth removed, has spacers in her mouth, and my son has teeth that have actually not come down. So there's work that we have to do, and I'm not afraid. I trust Dr. Karr. I believe in what she's doing and what she tells us need to be done. I trust her that she actually has my children's best interest at heart, and that what is going to happen is everything's going to be okay. We've had problems before where spacers have fallen out, or my daughter's gotten little popcorn kernels stuck, and we've come in and she hasn't reprimanded us, she hasn't been angry with us, but said maybe we should try this option or done something else. Everything has just been very easy, very calm, a very enjoyable experience, and I'm so thankful for finding Dr. Karr, because it's just been a huge blessing that my children are not afraid of the dentist and that it's actually a very good experience, and I feel like my children's teeth are in very good hands.
Hi, I'm Dr. Karr Corns. I'm a pediatric dentist here at Pediatric Dental Care. I just wanted to go over the importance of seeing your child every 6 months. At their checkups, we evaluate their teeth as well as their growth and development. We'll go over helpful tips for diet, oral hygiene, and we can discuss other preventative measures such as sealants. Sealants are a very valuable tool that we use. It's placing a preventive coating over the permanent dentition, and it helps to prevent cavities in the permanent molars. As well as going over diet, preventative measures that we could take, we also want to stress the importance of primary teeth. Even though they are baby teeth, they do serve a huge value for your child. They're used for eating, speech, and they're there to hold the place for the permanent teeth to erupt through. Sealants are a valuable preventative tool that we use in pediatric practice. The permanent sealants are very pitted, and there's lots of crevices on the chewing surface of the molars. So sealants provide a way to protect the chewing surfaces from cavities. This is super important since the permanent teeth, molars in the back, are the ones that are most at risk of getting cavities. So if we can place these sealants on early, we can ensure that your child has a happy and healthy smile for years to come. We look forward to seeing you soon at Pediatric Dental Care. Thanks.
There's a big machine that has lots of treats in it, and then there's lots of stuff in here. I put my coin in, and then something gets thrown in there and say cool. Something is cool. I just get something. And she's nice to me at Dr. Karr.
Hi, I'm Gabby. I'm one of the patient coordinators. What I like most about working here is how great the doctors work with the kids. Parents love having options when their little ones are too afraid or just too young. Dr. Karr offers nitrous oxide as an option to calm the child during the visit. Another option is general anesthesia. Dr. Karr has a board-certified dentist anesthesiologist that comes right to our office to cater to our patients, as well as privileges at Franciscan Healthcare in Munster, Indiana.
Hi, my name is Karen, and I am Dr. Karr's lead dental assistant. I have been here since she opened her doors back in 2007. I enjoy working here because Dr. Karr really cares about the kids and the quality of work she does. We strive to make every child's experience a good one. The good thing about Dr. Karr's office, we allow at least one parent to be able to experience that with them. Pediatric Dental Care utilizes the state-of-the-art sterilization and the latest equipment and uses all BPA-free material. One of the biggest questions parents ask is about our x-rays. We use digital x-rays, which use a quarter of exposure amount. I really believe children leave here feeling comfortable and safe and happy, wanting to come back. So I hope to see you soon. Thank you.
Hi, my name is Michelle and I'm a hygienist. Today we're going to talk a little bit about brushing. Here at our office, we recommend brushing 3 times a day. In the morning after breakfast, after lunch or after school, and then after dinner before going to bed. We also recommend flossing once a day. You definitely want to floss where your teeth are touching. If there are spaces, you do not need to floss here. When brushing, you want to make sure you brush for 2 full minutes. And you always want assistance by a parent through age 7. When you brush, we like to break it up into about 60 seconds for each quadrant. So if you start on the upper left, you want to brush for about 30 seconds on this side. So you want to angle your toothbrush and make sure you get all the way up in the gum line where which is where the pink meets the white. And you want to brush a nice soft circle for 30 seconds in each side. So if you start on the upper left, you want to brush along the gum line, on the chewing surface of the teeth, and on the inside where the tongue can reach. And you're going to do that all throughout the mouth. Kids specifically miss this area a lot of times because they tighten their lips and cover their teeth. So sometimes when brushing, especially the lower front teeth, you kind of have to push their lip out of the way so you can do a really good job of keeping these areas nice and